We just talked about how many people come to me where their underlying problems start in the gut. Another area that plays a big role ultimately with functional medicine is the skin. Your skin and abnormalities in the skin are often an expression of a dysfunction within the body. What's interesting is, where is this dysfunction coming from? I just spent a whole day virtually on lectures on functional medicine and gastroenterology and the gut. And one of the areas they spoke about is rosacea, a common problem that affects many people, particularly women over men. It's those pimple red area on the face that becomes very embarrassing. The standard treatment is the idea that it's an abnormality of the bacteria, and often it's treated with topical antibiotics. What's interesting is that it's demonstrated that it's often an expression of a dysfunction in the gut. One of the areas they show related to is SIBO, or small intestinal bacterial overgrowth, and addressing the SIBO and correcting that will help the rosacea. Hives. I'm seeing so many patients now with hives, more than I ever did. And what's happening is the hives are again an expression of an increased outpouring of histamine from the mast cells, those allergy producing cells in the body, and a diagnosis called mast cell activation syndrome is becoming something that we didn't even deal with 20 years ago. Again, it's the body on fire. The body's inflamed. It's overreacting. This increased release of histamine is causing hives and swelling throughout the body. I saw a patient with this unusual rash. The dermatologist couldn't figure it out. He was itching like crazy. He ended up having in its cutaneous mastocytosis. Again, it's from something going on in the body. Cleaning up the gut helps reduce rashes. I had a patient last year who for 20 years had this rash that several dermatologists told her it had to do with sun exposure. PMLE, they called it. And what happened was, it was due to light exposure. And so she kept saying, I think something else is going on. And they kept saying no. She said, what about my diet? They kept insisting it had nothing to do with her diet, but it was affecting areas that weren't sun exposed. We did the food inflammation test on her, and it was only positive to one food, corn. Within 2 weeks of going off corn, simple elimination diet, her skin eruption cleared for the first time in 20 years. It's incredible the association with different things in the body and how it is expressed in the skin.